This program is brought to you by Sav-A-Lot Nutrition Centers in Margate. And now, here's your host, Al Forman.
Start spreading.
Good morning, everybody. This is Al Forman for the Sav-A-Lot Nutrition Hour. It is Sunday. It is the 24th of September. But first, I want to remind everybody that we have a show today that you must listen to and observe. We have a foremost ophthalmologist who's going to be talking about the eyes. And I'm speaking about Dr. Josh Cohen, who is a comprehensive ophthalmologist and refractive surgeon at the Cohen Laser and Vision Center in Boca Raton. Dr. Cohen attended the prestigious Harvard University in Cambridge, Massachusetts, to study environmental science and public policy. Dr. Cohen spent 2 years teaching at his alma mater, the Pinecrest School in Fort Lauderdale. He then enrolled at the University of Florida College of Medicine in Gainesville, where he earned his doctorate in medicine. He proudly served as president of his class all 4 years and graduated with honors in research. Dr. Cohen began his medical internship in Jacksonville, Florida, where he met his wife, Rachel. He then started his training in ophthalmology at the University of Florida in Jacksonville before transferring to the University of Virginia in Charlottesville to complete his ophthalmology residency. He remained in Virginia for an extra year, serving as chief resident, and gained additional exposure to advanced cataract techniques and glaucoma surgery. Dr. Cohen lives in sunny Delray Beach with his family. He enjoys the arts, the outdoors, and looks to improve his tennis game all the time. So let me welcome in Dr. Josh Cohen. Good morning, Josh.
Good morning, Al. Thank you so much for having me on the show. It's a real honor.
Well, it's a pleasure to have you. I've been a patient of your dad's for a long time, and I've been a patient of yours for several years now. And I must say that you treat me terrifically, very gratuitously, and very sympathetically. And I want to point out one other major factor is your office doesn't let people wait the time they're due, which I find most exciting because most doctors' offices are always running behind. But when I visit your office for my appointments, I'm let in on time to see you, which I appreciate. And I think patients would also appreciate this because it happens much too often with other medical doctors that keep patients waiting beyond their scheduled time. Let me ask you to enlighten our listeners about your practice.
Sure. Well, thank you for that very, very generous introduction and for informing your audience that you are indeed a patient with our practice. As you mentioned, my father and I work together. And, you've been able to see both of us as your eye doctor, which is a real privilege. But my father started our practice over 30 years ago here in Boca Raton. And in our current practice, it's expanded through the years. We've had several different, surgical experiences that we are now offering to patients. And our main focus is really on getting you seeing as well as possible without glasses or contacts. That is the goal. But of course, we prescribe glasses and contacts if necessary. But we primarily focus on refractive surgery like LASIK and a new ICL implant for those between 21 and 45 who are nearsighted, and as well as cataract surgery and all types of cataract surgery, depending on different lenses and different vision goals for patients, whether it's being up close or far away or treating astigmatism or even using a laser to assist in surgery. We offer all of those services, as well as comprehensive eye care. So we'll look at the eye front to back. We treat dry eye. We offer specialized treatments for dry eye, like LipiFlow, and the newest medical treatments available now. We can talk about some of those as well. And glaucoma. So we manage glaucoma medically and surgically. For a period of time, we had a glaucoma specialist who was with us, but he just had a baby boy. So we wish him well, but he won't be seeing patients in our practice for the next few months at least as he stays home in Broward to deal with all the responsibilities of early parenthood, which I now know myself. So certainly can empathize with him there. But he was a great addition to the practice. But nonetheless, we still treat glaucoma, and even we'll look at retinal problems as well. And if you need a subspecialist for a retinal disease, we will refer out to a variety of very competent and well-trained physicians who focus on retinal care. So our office in Boca really will handle most eye conditions, and we welcome new patients. And it's just been a real honor to be a part of this practice and watch it grow and work alongside my dad and our amazing staff.
Well, I think you brought out some good points. I know that people listening to the show right now are probably interested in some of the practice work that you do there to help people see better. And my first question would be, the normal amount of time to visit an eye doctor is how long?
So we recommend for patients over 50 to be seen by an eye doctor, whether it's an optometrist or ophthalmologist, about every 2 to 3 years. That's generally the recommendation from the Academy of Ophthalmology. And then for patients over 60, we usually recommend seeing an eye doctor every year, and sometimes more frequently than that, depending on the conditions that one might have. And that just has to do with general changes related to the eye as we get older. Cataracts is among them. It's not really a disease per se. It's just like, as your hair kind of loses its color as we get older, the lens inside the eye gets more rigid, starts to crystallize and become less flexible. And those changes start even earlier in your 40s and 50s through a process called presbyopia. And that has to do with the requirement for reading glasses for a lot of patients. So those are all changes related to the lens inside the eye, and just one example of things that will happen as time goes on that often requires some appropriate diagnosis and measurements to make sure that you're seeing well. But generally, those are the guidelines. Now, a typical eye exam can run anywhere between 30 minutes and up to a couple hours, depending on how much testing is needed or whether dilation is required. A dilated eye exam requires drops being placed in the eye to open the pupil so that we can see deeper into the tissues of the eye, all the way to the back of the eye and the retina and the optic nerve. And while there are some shortcuts, you can take pictures of the eye, often doesn't give us a full 360-degree view that dilation would. So we still recommend a dilated exam, and for pretty much all the new patients that come in to see us, we usually recommend a dilated exam at that first visit. And that usually takes at least an hour and a half to come in and get checked in, fill out the paperwork, do the preliminary measurements, get dilated, and finish out the exam.
Would you venture to say, I'm asking this as a question to the people listening out there, because I think most of our listeners are in the age group that you mentioned, from 50 and up. I know we do have some people in their teens and their 20s that listen to the show on a regular basis, but the majority of people are probably in excess of 50. And my question is, could heart disease have an effect on the eyes?
That's a very good question, and the answer is yes. So heart disease comes in a lot of different forms. You certainly can have high blood pressure that can put stress on the heart, and high blood pressure does have specific effects on the eye, particularly the retinal vessels in the back of the eye. They can be put under stress from high blood pressure, and that can lead to hemorrhages or bleeds in the back of the eye in severe cases, or can cause inflammation and stress on the optic nerve. So though that is certainly a concern. Other causes of heart disease, like atherosclerosis, where you might have plaques that build up in blood vessels, those plaques can be liberated and actually deposit in the retinal vessels as well. And that can be a big problem. That can lead to strokes within the eye. That can be permanent and very debilitating, and oftentimes not really treatable. So sudden painless vision loss is certainly a concern, and one of those things that would require an immediate evaluation to see what the problem is. Other, general heart problems, like heart failure and things like that, don't necessarily have direct effects on the eye itself, but any disruption in circulation or pressure can affect the eye and the rest of the brain and nervous system as well, of which the eye is a part. So definitely important to, see your primary care doctor and a cardiologist if necessary, and then certainly an ophthalmologist if you have any vision problems.
Do you work with cardiologists and primary care doctors when you have a situation like that?
Yeah, absolutely. So we have a pretty broad network of doctors all through Palm Beach and Broward and even down into Miami or even farther north. And, certainly if there is a urgent issue or an impending risk to the eye, or if we look at the eye and say, wow, you have other problems going on. You have high blood pressure or you have diabetes, and sometimes those problems are diagnosed from the eye exam. Doesn't happen too often, but it is certainly possible. And then we'll refer out to get appropriate care and management as needed. As eye doctors, we don't typically prescribe heart medicines or blood pressure medicines or even blood sugar regulating medicines, but we can, if necessary, at least to kind of get things stable until a doctor can kind of take control from that point on. And every once in a while, we see a problem in the eye that requires an urgent evaluation or even a hospital evaluation. Just yesterday, I had a patient who came in for cataract surgery, and on his preliminary exam and on his heart monitoring, he had an irregular rhythm, and we had to cancel the surgery and send him to the hospital that very hour. So every once in a while, things pop up, and as eye doctors, we still have to be medical doctors, so we have to look at everything.
There are many different types of problems that you encounter. What is the most prolific problem that you have faced in your practice?
I would say that, there's probably four things that we see most commonly. The first is just what's called a refractive error. So the eye is not seeing the way it needs to, but not due to any medical problem in the eye, but just because the focusing elements, the cornea and the lens, are just not shaped properly according to the size of the eye. That's nearsightedness, farsightedness, and astigmatism. Those are definitely the most common reasons that people come in to see an eye doctor. And both ophthalmologists and optometrists can treat these problems with glasses and contacts, even reading glasses if needed, just for presbyopia, which is the condition I was mentioning earlier for patients over 40, 45 years old who might be able to see pretty well far away, but need some help up close, due to changes within the lens. That definitely is number one. Number two, I would say, is dry eye, and that can happen for any number of reasons as well. Dry eye certainly gets worse as we age as well, just due to the glands and lubricating elements of the eyelid not functioning as well as they usually do. And we treat that all day, every day with a variety of methods, whether it's drops or treatments in the office. But dry eye can be quite debilitating and bothersome for patients, but definitely is treatable. The third thing would be cataracts, like I mentioned. So everyone develops cataracts at some point, and most of us will need cataract surgery. I would say the average age for cataract surgery is probably around, 65 to 70. Some people need it younger. Some people elect to have cataract surgery, for patients who just want to get rid of glasses and might not be good candidates for other refractive surgery options like LASIK. Some people wait later in life because they're not having any problems and can function normally. But that, is certainly something that, we treat and see every day. And then the fourth is glaucoma. So glaucoma is a little bit more difficult for patients to know that they have glaucoma unless they see an eye doctor, because it's diagnosed with testing, not necessarily due to vision problems the way the other issues are. But glaucoma, far and away, is a real prevalent issue for anyone. Again, incidence increases as we get older. But I think that those four things probably constitute the bulk of our conditions that we see every day.
What is your belief in practicing when people have dry eyes? What is the course of action that you recommend for people to help eliminate or feel better even though they have dry eyes?
Sure. So there basically are a few different causes of dry eye. I would say the most common cause of dry eye is just kind of our natural environment and our lifestyle these days. A lot of us are on screens all day. So whenever we're paying attention to tasks at hand, our blink frequency decreases. So we keep our eyes open without us realizing it. And that contributes to evaporation. So the liquid on the eye just evaporates. So, you treat that with kind of monitoring your screen time. taking breaks when you can, and then refreshing the eye with artificial lubricants. So most over-the-counter eye drops are perfectly fine. There were some recall on a specific line of dry eye products that, certainly caused a scare due to contaminants and infection risk. But the drops that are available commercially today are safe. And just if you have any questions, talk to your eye doctor about them. But common brands that we recommend would be Refresh, Sustain, and Blink eye drops. You kind of want to avoid redness treating drops. So your line that has, brands that people might know like Clear Eyes or Visine. Now, they do make products that are fine for lubricants, but their most common products often contain either allergy relief or redness relating medicines that by treating redness, they constrict the blood vessels and can contribute to dry eye. But a regular lubricant is fine. If you need drops frequently throughout the day, like more than 4 or 5 times a day, then I'd recommend a preservative-free eye drop. Those are also available over the counter without prescription, and they are usually in special bottles or tiny little, almost like little plastic tubes that you pop open during the day and can use throughout the day. Then you just toss it. But without preservatives, then you can apply it more frequently without resulting in any irritation from that. Other common things that people can do at home is warm compresses, so a damp, warm washcloth at night. Throw it in the microwave for a couple seconds, get it nice and warm, and just lay it over your eyes for about 10 minutes. What that will do is that will melt the oil that lives within the eyelid. The oil is called meibum, and you have meibomian glands in the eyelid, and the oil can be softened by the heat, and that oil prevents evaporation, like I was talking about before. So that is certainly something that can also help. And usually a combination of those two regimens works fine for most patients. And anything else we'll certainly be able to identify in the practice to see what the underlying cause is. And other treatments might be necessary. Sometimes prescription eye drops and treatments are required.
Well, does the dry eye drop syndrome or problem with people, does that affect the strength of the eyeglasses that you would recommend?
Very good question. Typically, no, because any disruption in the what we call the ocular surface, so that's the cornea, the eyelid, and the conjunctiva, those three components of the eye are responsible for keeping the eye healthy and lubricated. You can get dry eye syndrome that affects your prescription, but those are temporary changes that can kind of be in flux by the hour or by the day or week. So we try not to recommend glasses prescription or a change in your prescription until we get the dry eye under control. Because while it can affect it, it doesn't do so in a predictable manner. So most of the time, we would recommend keeping what you have as far as your prescription for glasses until we get the dry eye under control, and then we can update the glasses at that time.
Now, what about the other issue where people have wet eyes or I guess
tearing?
Is that what the term is, wet eyes?
Yeah, so if people have, if the eyes are too wet or the tears are dripping down the face, we call that epiphora. That's the clinical condition that we use to treat that. And believe it or not, that can also be a symptom of dry eye, even though it sounds counterintuitive. But sometimes if the eye is dry, you get what's called reflex tearing. So the eye senses irritation from the dryness and produces excess tearing to try to treat that. But oftentimes those tears contain elements within the tears that affects the quality of the tear film. There are white blood cells that get secreted in the tears, and that can further damage the eye, even though your body is doing the best it can. So we have to figure out why you're tearing. And it could be due to excess tear production, like I was just mentioning, or due to insufficient drainage, which is not really a cause of dry eye, but a cause of, like you were saying, wet eye. So that would be a reason for epiphora to not be due to dry eye, but that would be due to a blockage oftentimes in tiny little holes in the eyelid called puncta. There's little canals that drain fluid into your nose, and if one or both of them are obstructed, then you're going to get excess tearing collecting on the eye, and that's an issue that requires different treatments. Sometimes we have to flush those out, or we have to do surgery to position the eyelid properly to make sure that those drains are open and accessible to the tear film. You can also get a loose eyelid or a tight eyelid. Those are specific problems that can also affect how the tears flow and coat the eyeball, and that requires an evaluation to figure out if that's what you've got. And usually a oculoplastic surgeon can treat those conditions.
Is that something called macular degeneration?
So macular degeneration is a problem in the retina. Very common problem in patients of advanced age, because it's usually age-related macular degeneration, or ARMD. That's the abbreviation that's used medically. And that can come in two different forms, wet and dry. But these do not affect the tear film. So wet and dry macular degeneration does not contribute to wet or dry eyes, or dry eye problems specifically. Those are problems on the surface of the eye. Macular degeneration is a problem inside the eye where the retina lives, in the very back of the eye. That also requires a diagnosis by an eye doctor to look directly at the retina, the appearance of the retina, and then oftentimes we do some testing with different scans and pictures and photographs of the eye to determine what the problem might be. The macular degeneration is due to an accumulation of toxins within the retina, where as we get older, our body doesn't break down these toxins properly, and these little areas where the toxins accumulate are called drusen, and they can cause a breakdown in the rods and cones of the retina, and ultimately the blood supply of the retina that can contribute to wet macular degeneration. So it's a continuum, and it is a complicated area of treatment. There's a lot of new medicines that are available now, and retina specialists are tasked to decide what treatment option is right for you. Dry macular degeneration is really not treatable, but there is a form of what's called geographic atrophy, which is a breakdown of the rods and cones that is treated now with a special injection that's prescribed and administered by a retina specialist.
Do you do also surgery when it comes to that?
So for macular degeneration, typically we don't do surgery. Typically we would do injections in the eye if necessary. But eye surgeries generally, yes, I do eye surgery, but I don't do macular degeneration surgery. But surgical techniques that I would use would be those to treat cataracts, to treat glaucoma, or to treat refractive areas or corneal problems, like corneal transplants, things like that. So I usually focus on the front of the eye.
And how do you treat glaucoma?
So glaucoma is a problem of the optic nerve, which is the cable that connects the eyeball to the brain. It's almost like if you imagine like a digital camera, the eye is the camera, the brain is the computer that's going to process the image, and then the USB cable is the optic nerve. So pressure from inside the eye can put stress on the nerve, and glaucoma is basically how we quantify and determine that there is, in fact, a pattern of damage to the nerve that we can measure. And that usually presents as peripheral vision loss or problems seeing off to the side. But the central vision, fortunately, doesn't usually get affected until very late in the disease process, unlike macular degeneration, which affects the central vision. And unlike cataracts, which usually affects the vision overall as well. People don't really notice that they have glaucoma, which is what makes it kind of scary in that regard. And that's why you need to get your eyes checked so that we can measure the eye pressure. Now, eye pressure is a contributing factor for glaucoma, the most important and the one that we treat. But in general, glaucoma falls into two categories in terms of how the fluid is drained, whether or not the filtering system in the eye is open and just not functioning well, or whether there's an anatomic constriction or blockage of the angle or the drainage system. That's called narrow angle or closed angle glaucoma. And there's basically different treatments that are involved depending on the type of glaucoma that you might have or depending on the type of anatomy that you have. But broadly speaking, most people treat glaucoma with eye drops that either reduce the amount of fluid being made or increase the drainage pathway or the access of fluid to drain out of the eye into the veins. And if drops don't work, then we can try other options. The next step that most people get would be some sort of laser treatment done here in the office to either clean out the filter, or if the angles are narrow, we can basically blast a little hole in the iris, which is the brown or blue part of the eye, to allow fluid to circulate more properly. And then in more severe or advanced stages of glaucoma, or if the pressures are high despite all these other modalities, then surgery is used. And different glaucoma surgeries can be done by different types of eye specialists. As a comprehensive eye doctor, there's some glaucoma surgeries that I perform, but for severe cases, you would want to visit a glaucoma specialist who can do other types of surgeries that would expand the volume of the eye to bring the pressure down.
I have one question with relation to glaucoma. Does diabetes affect glaucoma?
Another really good question, Al. Generally, not directly. Now, diabetes affects the eye in other ways. Diabetes affects the eye in terms of the blood supply to the eye, the nutritional amount of basically metabolic requirements of the eye can be affected from diabetes. And there are definitely medications that people can take for diabetes that can affect the eye. But generally speaking, diabetes doesn't affect eye pressure or the problems related to glaucoma specifically, with one exception. In very severe cases where blood sugars can get quite high from poorly controlled diabetes, then the lens inside the eye can sometimes swell. That can affect your prescription. And sometimes the lens inside the eye gets thick enough or swells enough, then that can contribute to a problem called narrow angle glaucoma, like I was mentioning before, and that can contribute to a rise in pressure and therefore contribute to glaucoma. But the link between diabetes and glaucoma is not very strong.
My question before the break, Dr. Cohen, was cataract surgery, and I know that's something I'm planning on getting done on my next visit when I see you. But what is cataract surgery?
As far as cataract surgery is concerned, so cataract surgery is an outpatient procedure. So it is done under local anesthesia, most commonly, under light sedation, kind of like getting a colonoscopy. You're not fully asleep. It's a procedure that involves removing the natural lens of the eye that becomes a cataract as we get older. Now, cataracts can develop at really any age. Some people are born with them, called congenital cataracts, which is a clouding of the lens, or they can happen from trauma or injury to the eye, or they can happen from other problems like diabetes or certain medications, or from steroid use. There's a lot of reasons for people to develop cataracts, but nonetheless, the treatment is pretty much the same for most patients across the board. And it basically involves making a small incision or a cut through the front of the eye. And these cuts are made with microscopic instruments. This is a painless process. The whole thing takes about 10 or 15 minutes for most patients. And the cataract is broken up into little pieces with special equipment and machines that we use. And we kind of vacuum those pieces out of the eye. And then before surgery, we do measurements on the eye to determine what to replace the lens with. So we need to replace your natural lens with an artificial lens called an intraocular lens, or IOL. And there are different types of IOLs, and we can get into that in just a moment. But these IOLs are basically custom fit for each patient's eye. And the right eye is different than the left eye, and everyone has individual measurements to determine what type of lens is appropriate. But once the cataract is removed, these lenses are basically folded up into almost like a little taco, and then they are opened up inside the eye. They settle into position, and the doctor rotates them and tucks them exactly where they need to be. And then the instruments are removed out of the eye, and the wounds seal, oftentimes without any stitches. And most people get vision within a couple days. And there are some restrictions. We give you eye drops after surgery to prevent infection and to control inflammation. And it is a very, very common procedure and a very safe one as well. The risk of complications is quite low. And, there certainly are things that you have to be aware of. And, there certainly are concerns that, you and your doctor can always discuss. But generally, it's a very commonly performed procedure with a very high success rate. And most people see great afterwards.
Well, what are the signals that tell people that their cataracts have a problem?
So the most common complaint that people have as they start to develop cataracts is just a general blurring of the vision. They feel like that the glasses are smudged, or they're wiping them, and they just can't seem to get things in focus. Or they just go to the optical shop or go to their doctor and try to get a new prescription, and it's just not working. That's definitely the most common cause. The other thing people notice is just glare at night. So some people might be driving at night and they notice that headlights have a bit of a flare. that there's a glow around lights that's affecting their ability to see clearly. Or patients might have trouble seeing in low light environments generally, reading menus at a restaurant, or just needing more light to see things that they were able to see before. And then the last complaint is objects and vision general just appears dim or almost yellowish or grayed out with less contrast. That's a symptom that people complain more later in the cataract stages as things get more dense and the lens gets cloudier. But those things more or less, or some combination thereof, are what people come in with if they are starting to feel the symptoms of cataracts.
Cataracts reoccur in the same eye?
So once the cataract is removed surgically, it actually can't come back. Another really good question. Now, what sometimes happens after cataract surgery, that some people call a secondary cataract, is simply that lens material, little debris from the original cataract, can sometimes be left behind. Even though we get the structure out, sometimes little remnants can be left behind, even with perfectly performed surgery. And if they continue to grow, then they can form like a little sheet or a film over the lens. That's called a posterior capsule opacification, or PCO. And fortunately, that doesn't require surgery to treat. We often can just kind of polish that off with a laser in the office after surgery. And cataract surgery itself, if the vision is bad enough and meets requirements, is covered by insurance. And this procedure would also be covered by insurance. Now, what might not be covered by insurance are upgrades to cataracts with different lens options. And Al, if you want to talk about that, I can quickly touch on that as well.
All right. I'm sure that people are very interested in hearing about that, considering the fact that as they get older, they could develop a cataract situation where it has to be surgically done at your office. And what is you said it only takes about 10 to 15 minutes to get the surgery done. How long is the rest period after that?
So we usually recommend about a week of light activity, limited exercise, being careful getting water and soaps in the eye. But usually we advise patients that they can shower the next day as long as, they close the eyes and they follow the instructions to use eye drops as prescribed after surgery, and wear a shield at night so that no one rubs the eye accidentally and causes any injury to the eye or the wound itself. But usually within a week, the vision settles down and most people are able to return to normal activities.
If anybody has any medical situations, would cataract surgery not be able to be performed?
Yeah, as I mentioned, that happened to a patient yesterday. So sometimes there are certain situations where the patient might have, trouble lying flat, or might need additional assistance, or might need additional sedation than what we typically provide, in which case we might need to use a hospital system to do the surgery. Or if a patient, unfortunately, really is sick enough where they're not able to have any procedure done, then we wouldn't do that. Cataract surgery is still considered elective in most cases because the lens will just continue to grow, and it's a, more or less a gradual process that takes many, many years. So, usually we can afford to wait a little bit longer to do the surgery safely and make sure that the rest of the body is healthy enough for surgery. There certainly are some exceptions if there's injury to the eye or infection, or if the pressure is not controllable, then sometimes we have to do things more urgently. But generally, of course, we want to make sure that the patient's safe. And usually that would, if there's any concern, we'll have you see your primary doctor, just get a general workup and make sure that you're cleared for surgery.
Dr. Cohen, we're coming up on the close of the show, and would you please repeat your address and phone number for people to get in touch with you so they can schedule an appointment to help their eyes feel better and look better?
Sure. Again, I thank you so much for the opportunity. I want to wish all the listeners and Jewish listeners a happy New Year and an easy fast for Yom Kippur. But our address is 3020 North Military Trail. The suite is 150. That's in Boca Raton, Florida, 33431. Our website is www.cohenlaser, COHENLASER.com. That's for Cohen Laser and Vision Center. Of course, you can find us on Google or any search engine as well. And our phone number is 561-981-8499. So 561-981-8400.
I thank you very much, Dr. Cohen. I wish you and your family a happy Yom Kippur, a good year, and a healthy year. And thank you for being with us today.
Thank you so much, Al. I appreciate your time, and I send my best to your family as well.
Thank you. I'll be seeing you in the next couple of months, I'm sure.
Sounds great. Thanks again for the opportunity. It's a pleasure.
Thank you. And again, if you missed any part of the show, go to our website, go to the archive radio shows, and you can listen to Dr. Cohen talk about all the different eye situations that we've covered today on the Sav-A-Lot Nutrition Hour.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.